know he wishes to address.
Thank you, Dr. Jindo. This is something I'm very passionate about. But I'm a family doctor here in Barrhaven, and I know over the last 7 years you've heard a lot of speakers. They've talked about advances in medicine, and that they've been great. But this is going more back to the basics, exercise. This is something we've known for many, many years, the benefits of it. And we'll just go over it. And so we'll get started. We'll start with some basic definitions first. What is physical activity? So it is any sustained body movement that increases energy expenditure. So doing household chores, running after the kids or grandkids, going out for a walk, that's physical activity. So there is a difference between physical activity and exercise. Exercise is a planned, purposeful physical activity that is repeated, regular basis to improve or maintain one's health. The key here, it has to be repeated and regular. So it's very important. Exercise for its benefits is a marathon. It's not a sprint. Something you want to do consistently throughout your life. Now we'll talk about the different types of exercise. There's aerobic exercise, resistance exercise, and stretching. And we'll go over these. They are separated into these three categories, but many times when we exercise, there's a little bit of every one of them in our activity or exercise that we do. Aerobic exercise is any exercise which increases the blood flow through the heart. So things like cycling, running, swimming. Resistance exercise, any exercise which increases muscle strength. Examples of these would be push-ups or squats. They can be done with body weights or with weights. That's the traditional thing we think of when we talk about going to the gym, with the exercise equipment, whether it's free weights or the machines that they have available. Stretching exercise, which improves with mobility and flexibility. An example of that would be yoga or Tai Chi. Now the World Health Organization, or WHO, has recommendations for exercise. People between the ages of 18 and 65 should exercise moderately 150 to 300 minutes a week. Now what happens as we get older? The same thing, 150 to 300 minutes of exercise. And I purposely made this slide this way, because as we get older, the importance of exercise does not diminish. And data is quite clear. It's even more important as we get older. Canadians, how are we doing compared to the rest of them? This is a self-reported study by Stats Canada from 2017. You can see at the early adulthood, 18 to 34, about less than 70% of us exercise regularly. And then by the time we're 65, less than 50% of us exercise on a regular basis. And that clearly shows that we can improve. Exercising 150 minutes a week. 150 minutes a week? How am I supposed to do that much exercise in a week? It can seem overwhelming, but break it up into parts. You can do 30 minutes, 5 days a week, or you can just do the 3 times on the weekend. And even if you're talking about the 30 minutes, that 30 minutes throughout a day can be split up. It can be split up to 10 minutes at a time. And for exercise to be beneficial, it must be 10 consecutive minutes. So what you can do on the way to work, stop 2 or 3 bus stops before your work. You can walk for 10 minutes and then walk back. There's most of your exercise done for the day. You could do exercise during lunchtime. A half an hour walk during lunch. You'll be more invigorated and you'll have more energy. And you'll be more productive in the afternoon. Your boss will love you for it. Okay, the other thing is we can't overdo it with exercise. So if you're exercising, you shouldn't do more than 100 minutes consecutively. After that, there's higher risk of injury, so about an hour and a half. Also, with this, the first 100 minutes gives you the most benefit. There's still benefit after the first 100 minutes, but you won't get the benefit per unit time after the first 100 minutes. And the benefits, the marked benefits are in the first 30 to 45 minutes. Okay, these are some examples of exercise, and you can see it's quite a long list. It's obviously not all-inclusive. Something as simple as washing your car. Eventually, we will be able to do it this summer.
Yes.
Dancing that is a form of exercise, so you can do that. And you can see at the bottom more traditional things like stair walking or climbing for 15 minutes. Gives you the exercise that you need in a day. Now the health benefits of exercise. Right now, I'm going to concentrate on things that are prevented with exercise. So we'll go through the list. Okay, first of all, moderate exercise reduces your risk of premature death from all causes, whether it's heart disease, cancer, lung disease. So if you're exercising 150 minutes every week, you reduce your risk of dying prematurely by 23%, so by a quarter. There's nothing I can tell you here, today, tomorrow, that will reduce your risk of premature death by 23%, other than quitting smoking. Smoking is the one thing that has more benefit than exercise. Despite all the medications and all the advances we've made, this is still the number one thing. Moderate exercise increases your life expectancy. This is one of the things I heard when Dr. Jindo was speaking earlier. You can see if you start exercising at the age of 50, 150 minutes a week, men will increase their life expectancy by 2.4 years and women by 2 years. So not only... This is the Munder, you'll have to ask him. These are studies that have been shown. With all that, as I said, exercise has been here forever, but we're just starting to do these studies individually to see. So we haven't got all the answers yet. Cardiovascular disease, heart attack or strokes or angina. Exercise reduces the risk of heart disease by 23%. That's remarkable. Again, smoking is the only thing that will improve your chance of not having a heart attack. And especially in this audience, we're all predisposed to having heart disease. Smoking has a higher risk, can reduce your risk of heart disease more than exercise. That's the only thing we can do. Not smoking, quitting smoking. Quitting smoking. And then we go next to hypertension or high blood pressure. Exercise can reduce your risk of high blood pressure and can reduce your your blood pressure by 5 to 15%, 5 to 15 millimeters of mercury, which means you may not need to take that medicine that the doctor prescribes you. And that's a lifelong thing. And on top of not having to take a pill, by your blood pressure being lower, your risk of heart disease goes lower. Lipid profile or cholesterol. Moderate exercise reduces your bad type of cholesterol or LDL. Not only does it reduce it a little bit, but it also changes the composition of the LDL. So it doesn't stick to your blood vessels the way it does if you don't exercise. So it doesn't clog up those arteries and increase your risk of having heart disease. And it improves your HDL, the good type of cholesterol. Now that is with a bit more vigorous exercise that you can increase your HDL. Improved glucose tolerance. The old term used to be pre-diabetes. But if you do have impaired glucose tolerance, by exercising, you can slow the progression down so you don't become a full-onset diabetic. And especially if you're in the high-risk group, whether you're family history, somebody from India, South Asian descent, or from the indigenous population, exercise can reduce your risk of having diabetes and all the complications that come with diabetes. Exercise reduces your risk of cancer, and we'll go over some of these. Bowel cancer or colon cancer. By exercise, you reduce your risk by 27%. 27%. So you can make a big difference in reducing your chance of getting colon cancer. Breast cancer. Everybody in this room, I'm sure, has known a family member or dear friend who has contracted breast cancer. Postmenopausal women. Moderate exercise reduces the risk by 12%. Endometrial cancer, or cancer of the uterus. For women who exercise regularly, a 20% reduction in endometrial cancer. Other cancers which are helped by increasing your exercise level. Bladder cancer, stomach cancer, prostate cancer, and lung cancer. Mental health benefits of exercise. A few months ago, somebody came and talked to us about depression. And I know he mentioned that exercise can help reduce the risk of depression. Studies clearly show that if you do exercise, your risk of depression diminishes. Risk of dementia. As we're aging, dementia is becoming much more prevalent in our society. But again, with exercising regularly, you can reduce your risk of dementia. Improve stress management. We all have stressful lives, whether it's running to get our children on activities, things at work, or the grandkids. Stress is a part of the human condition. We cannot eliminate it. So how do we cope with it better? One of the ways is stress management. You can cope with the stresses that we all have. The sense of well-being. I know for myself, on the day that I don't feel like going to the gym and I drag myself there, I always feel better when I get out. And I'm sure you have noticed the same thing. When you do get outside, no matter what level of the exercise is, you do feel better. And if you do that consistently, it lasts longer in the day and throughout the whole week. So you're feeling better overall. Improve sleep. Exercise regularly helps improve sleep. The caveat with this is you should finish exercising 2 hours before you go to bed. So do your exercise earlier in the day and get a better night's sleep. Osteoporosis. Again, we're hearing more and more about osteoporosis. It's the thinning of the bones. And by exercising, weight-bearing exercises such as walking helps prevent the thinning of the bones. Therefore, if unfortunately you do have a fall, it reduces your chances of breaking a bone and all the results that come from that. Reduce risk of falls in seniors. Exercise reduces your chances of having a fall, and that is significant. Even if you don't break a bone, you still get significant muscle damage. That reduces your ability to function, reduces your ability to walk in the future, and causes a loss of independence. And for seniors, falling is one of the biggest risk factors in terms of well-being. Now, pregnancy and exercise. It reduces the excessive weight gain through pregnancy. I want to stress, weight gain is normal during pregnancy. It's the excessive weight gain that we get concerned about. Gestational diabetes. Again, reduced risk of gestational diabetes results in much healthier babies. And postpartum depression for the mom. If she exercises through her pregnancy, there's decreased risk of postpartum depression afterwards. We're recognizing this more and more. And with healthier moms, of course, are healthier babies. Weight management. This is one of the topics that came up. I want to stress, exercise is an important part of weight management, but you shouldn't look at exercise as the sole source of losing weight. The main reason we should exercise is for our health benefits, our fitness level, our sense of well-being, and reducing the risk of some of the conditions I mentioned. For most of us who will exercise, we will burn about 350 calories in an hour. That's 2 cookies. So if you treat yourself afterwards with 2 cookies or that little bowl of ice cream, you broke even in terms of your calories. But you did get the fitness benefits, the health benefits. Those are still there. Conditions. We'll go more from a prevention point of view to medical conditions after you have them, how exercise helps them. Cardiovascular disease. If you've ever had a heart attack, or you've had bypass surgery, or angioplasty, or ballooning of the blood vessels. If you've had that here in Ottawa, you know the Ottawa Heart Institute, a major part of the program after you've had one of those procedures is the rehab part. The rehab part stresses the exercise, getting you back exercising. After the initial recovery phase, they want you to get up and doing things. Not 50 years ago when we used to keep you in bed for weeks on end after a heart attack. Usually within a week, they're getting you up on the floor, and they have a specialized, actually they have a track at the Heart Institute, that's part of the rehab program, to get you up exercising. And that helps prevent future heart attacks, but also it improves your quality of life, gets you back to doing the normal things that we all enjoy doing. For diabetes, if you do have diabetes, exercising helps control your sugars so that you get a more level state throughout the whole day. And it may mean not going on that extra pill, or eventually going on to insulin or other injections that are available now. Lung disease. We talk about asthma and COPD. With exercise, it improves the efficiency of your muscles, so you're able to do more. It doesn't increase your lung capacity if you have COPD, but you end up being able to walk up those stairs. Maybe walking the extra half block, or spending the extra 15 minutes in the park with your grandchildren or children. Cancer-related fatigue. If you do suffer from cancer and you're undergoing active chemo and radiation therapy, there's always fatigue associated with that. And exercise can help with that. You get more energy. Your emotional state is better, because this is probably one of the most stressful time in anybody's life if they're dealing with cancer in any way. And by exercising your emotional state, you have more energy, you're sleeping better. We'll talk about resistance training in particular. As a normal part of aging, we all lose muscle mass. That happens to all of us. So we have to make an effort to do the resistance training to help keep our strength and to keep our muscles, because that is going to be very important as we age. One thing I would stress with resistance training, if you haven't done it before, you can get some guidance from a physiotherapist or a personal trainer. They are available through the city and many of the private gyms. So don't rush to go out and start doing bench presses or squats with weights if you haven't done that before. Medical conditions that can improve when resistance training is added to an aerobic exercise program. We'll go through some of these now. Osteoarthritis. Almost all of us will get osteoarthritis as we age. And with the pain, often people will stop being active. That reduces their muscles. And that perpetuates the pain cycle, and you do less, and then the muscles get weaker. So it is important to do some resistance training, keep those muscles strong, so you are able to walk and do your other activities. Cardiovascular, we've talked about before. In terms of chronic renal disease, as renal disease gets worse, part of the condition results in loss of muscle mass. So it is important to do the resistance training. Again, your sense of well-being, chronic renal disease, if you have it, can be quite a challenge for anybody. And so by doing the exercise, you build the muscles and you're able to do the things you enjoy doing. The mental health benefits. We talked about prevention, but studies are quite clear about mental health. If you have mild clinical depression, exercise is equally as good as any medication. I want to stress mild clinical depression. So you exercise, that's one less pill you have to take. And I don't know anybody who says, give me more pills. Everybody wants to do it without pills. So this is a way you can help yourself. Parkinson's disease. Parkinson's disease is a condition with tremors and problems with stance or gait or walking because you feel so unsteady on your feet. With resistance training, you can build up the muscles so you feel more steady on your feet. You're a bit more independent. After stroke rehab. After somebody has had a stroke, where one side of their body gets paralyzed, the resistance training part of the rehab is what gets you up walking again, use of your arm, and getting you back to the best you can be so you can function in everyday life. Maintenance of weight loss. When it comes to resistance training, by doing that, we build more muscle and we burn fat. Okay? So when you have more muscle, you burn more calories per pound of muscle than you do per pound of fat. So sometimes you hear the term, I don't understand it, I'm not losing the weight, but my clothes fit differently, or my belt is one notch tighter. That is still very important, because when you do that, you're building more muscle, and you're able to burn more calories just sitting here. And as you burn more calories, that's a great part of a weight loss program. Now, let's look at some ways we can be successful in exercising. We all have good intentions when we start. But this is a way to help prevent some injuries so you can exercise for a longer period of time. Like warm up, do a little bit of a walk, a bit of cycling. Okay, that should be about 5-10 minutes. That helps your muscles warm up, so when you do a bit more of an advanced workout, you will not injure yourself. The workout itself, with moderate exercise, it can be aerobic or resistance training, or a combination of the two. So the half hour you spend there. And then, as we age, the cool down is so important. You can't go from a workout, let's take a shower and get back to work. You have to cool down, doing some stretching afterwards. That will improve your sense of well-being, because you won't have the muscle soreness after working out, and you won't have the injuries afterwards. So those things are important. Okay, what else can we do to make ourselves more successful? Often we get asked, what is the best exercise? And my answer is, what do you like to do? If I tell somebody who hates cycling, cycling is the best exercise, they're not going to do it, or they might grudgingly do it for a week or two. But whatever you enjoy, whether it's playing tennis, going for a swim, going to the gym, pick something you enjoy, because then you're going to stick with it. Exercise with a partner. Oftentimes, there are days when you don't want to exercise, but you're exercising with a friend, with your spouse, and they'll drag you to the gym or to going out for a walk that day. So that will force you to do it. And you'll help them, because there'll be days they don't want to do it, and you drag them along. Make it a part of your daily schedule. If you're working, setting up a walking club at lunchtime with your coworkers. So that as a group activity, that helps in keeping with the schedule. And when you do exercise and you're able to pick up, you're going to be more productive through the day. So that task that takes you 2-3 minutes less this time, and another task, by the end of the day, you made up that half hour. So you're doing all the things that you did previously, but you're still fitting in the exercise. Set realistic goals. If you haven't exercised for years, to think in 2 or 3 weeks you're going to be back in shape, that's unrealistic, and you're going to get frustrated and throw your hands up and say, I'm not going to do this. So have a plan for 2 to 3 months, and look at every month how you were compared to the month before. No matter who you are, whether you're a professional athlete or a beginner, you will have good days and bad days. And if we just concentrate day to day, that's where the frustration can build up. So look at what you did at the beginning of the month. At the end of the month, you will see there's an improvement. And that will encourage you to keep working towards the next task. Exercise where you feel comfortable. Some of us feel comfortable in the gym. Others don't. That's okay. Some of us feel comfortable at home. Some people like to go for walks in their neighborhood. Whatever you feel comfortable in. And where you put the exercise equipment. I'm sure all of us have had a treadmill that's in the basement. The best dust collector that you have. Okay? Put the exercising equipment in an area where you enjoy being, or where you will see it every day. So if it's in the bedroom, if that's a possibility, you'll see it in the morning, you'll be motivated to do it for next time. Downstairs in the basement, you don't see it, you don't even think about it. And there's many other ways to exercise. The traditional ways with the gym or exercise, now there's many YouTube videos you can go to. It starts from beginners to very elite athletes. Any age group, they can set you up. There's chair exercises if you have a difficult time walking. So there are many ways to exercise. And measurement. A Garmin, a Fitbit, or an Apple Watch. That keeps you accountable to get those 10,000 steps a day. So you will continue working. And that helps keep up with your exercise level. Now I just want to show you a picture. This gentleman, some of you may recognize. His nickname is the Turban Tornado. At the age of 89, he started exercising and running. In 2003 in Toronto, he ran a marathon, 42 kilometers he ran. He holds the record, world best, at 5 hours and 40 minutes. He ran 42 kilometers. His last full marathon was in London in 2011. His last competitive race was in Hong Kong in 2013. And why did he start running at the age of 89? To help alleviate the symptoms of depression. That's why he started running. Some may look at this as an inspiration. If a gentleman at 89 can train and run 42K, sure, we can exercise 30 minutes every day.
How old is he now? How old is he now?
He was born in 1911. Of course, he was born in India, he lives in Britain right now. Of course, there's no birth certificates in India from 1911. So nobody officially recognizes his age. But he would be, what, 108? Oh, 108 now. Okay. If I could give you a prescription where you could reduce your risk of heart disease, reduce your risk of cancer, reduce your risk, improve your lifestyle, improve your stress management, the pharmacies couldn't keep it on the shelf. But this prescription has been around for thousands of years, and it is exercise. Thank you. I'll just do aerobic exercises.
That's the one?
Yeah.
So what exactly is that you are pumping blood more into the tissues where it's needed? Oxygen?
You're pumping blood through the heart, which the heart is a muscle. So you want to pump through the blood through the heart to improve the oxygenation and improve your heart function. And it also pumps blood throughout all the muscles and all the other tissues in your body.
Aerobic is oxygen. Yeah. We have to keep track of heart rate.
Yes. If you're just starting out, the maximum heart rate we recommend, and the rule of thumb is take 220 minus your age, and 80% of that is the maximum heart rate, 65% if you're just starting out.
You have to remember that.
120 minus your age.
220.
220 minus your age. And if you're just starting out, we'd like to see it at 65% of that number. And if you're a bit more advanced, no more than 80% of that number.
We'll give it to you somewhere, this information. Then you mentioned some about the anaerobic.
That would be the strength exercises, more muscle building, muscles.
That's the one that you referred to. Any questions on the type of exercise? Anybody? Yes.
Is there such a thing as overdoing it? Because I've actually been reducing the pulse in my eyeballs, like, I was wondering if that was too much.
You can overdo it in duration and with the intensity. If you keep the track of your heart rate, that will give you some guidelines.
Okay.
And you don't
Anybody?
want to
Type
cause-
of exercise. Type of exercise.